Hey everyone, I am Gary. If you know me, welcome back to my channel, and if you don't, I am a student respiratory therapist, and I'm going to tell you guys about my first semester as an RT student. So let's go. So how was my first semester? How was my first clinical experience? Let's break it down. Your first semester as a respiratory therapy student is, for me at least, was just trying to figure out the proper ways of studying, what were good study techniques, how, like, your first quiz, your first test, you're like getting the hang of like, okay, these are how the questions are gonna be. And so that's kind of how like the first couple quizzes are, and you're just getting the hang of like the professor and how they are going to be testing you. So the classes we were taking were cardiopulmonary anatomy and physiology and an intro to clinics lab and lecture class. And the cardiopulmonary anatomy and physio class was known to be the class that like kind of weeds people out, or a lot of people fail. And if you fail, even if you pass your intro to clinics class, you have to retake both those classes next year with the new set of RT students. And I feel like that was a big weight on everybody's shoulders, like, oh my gosh, if I don't pass, I have to wait a whole year. And so I feel like that was probably just the hardest part about the semester, because there were second year RT students who were like, yeah, I had to retake it. And you know, I was surprisingly like calm throughout the semester. I thought the class was going to be super hard, but it was something that I thoroughly enjoyed, and my professor taught it in a way that like I felt like made it more enjoyable. But then towards the end of the semester, I feel like after spring break was when everybody was kind of like thrown for a loop, you know, like we were on vacation mode and we came back and it got super hard. So my main advice is definitely continuously pay attention, continuously study. It's all about time management. Like, you can totally do it. Trust me, if I can do it, you can do it. Don't give up. If you feel like you're getting behind, definitely ask questions, make friends, ask them what they're doing, because if you get behind, once it starts getting really hard, it's going to be even harder for you. So you really want to understand the basics, especially like the first half of the semester. You really want to understand the material. So my advice is just don't get behind, just study and read and do what you're supposed to do, and you know, don't be going out to the club when you should be studying for a quiz in 4 days, you know. Just study and you can do it. And yeah. So my first clinical rotation, you guys, this is like your first, at my school, we don't wear our scrubs, we don't wear our stethoscope, we haven't tested anything out. So our first day, they just kind of throw you in there, you're going to the hospital, and you're like, oh my gosh, like, ugh, it's happening, I'm here. And thankfully, my first rotation was with one of my friends, so it helped make it easier that we tried to plan our 5 clinical rotations to where we would at least have one, and we thought having our first one together would have been the best, just so we can kind of like ease into it together. And I highly recommend that if your program lets you kind of choose your rotations and which hospital you're going to, definitely make your first one with a friend, because it just makes it that much easier. I'm going to break down kind of like what you do as an RT, because I feel like it's not really talked about. So you go in the morning, and your preceptors, which are respiratory therapists who work at that hospital, well, the night shift is giving a report to the day shift. And so they're telling you about like, or they're telling them about the patients and how they were, if they had any like changes, and why they're there, etc. Like, some patients you already know because they've been there for a couple weeks, but some are new, and so you're just giving a report, and then after report, the charge RT assigns you to your preceptor for the day. And so my first preceptor is assigned to the ER, so I'm assigned to the ER on my first day, and I'm just like, oh my god, like the emergency room on my first day, are you crazy? But you know, looking back at it, I'm just so glad that I was like thrown into it, because I feel like that's how you truly learn, is just being thrown into like intense situations. But at the same time, you're gonna go through moments of feeling like you're not that helpful, you know, like it's still your first week and you don't really know much, you don't know your way around the hospital, you haven't like talked about this or that in class yet. So there's definitely going to be periods where you feel like you're a little useless or you're kind of bothering your preceptor. But I was thankful enough to have like really good preceptors who genuinely were great respiratory therapists and taught me so much. And you know, you'll learn like your little techniques from this RT, and you'll learn like kind of not to do something how another preceptor might do it. But yeah, it was definitely a great experience. So I want to talk about my MTF MD1 stethoscope. This is amazing. At first I was worried, like, I don't know, it's not a Littman, like it's gonna be as good. Like I can hear everything with my stethoscope. One thing that I did realize is that it's pretty heavy, and at first you don't really think anything of it until like hours later, and like this is around your neck and you're kind of like my neck's a little sore, and you're like, oh, maybe I shouldn't be wearing my stethoscope all day. And so, you know, just kind of like tuck it in your front pocket when you're constantly using it. Like it's just easier around your neck. But if you're on a break, if you're on lunch, if you're walking around, if you don't have that much to do, definitely stuff it in your pocket to save your neck. Something that I highly recommend is a little notebook. I got my notebook from a Korean store here in Los Angeles, and it was really cheap, and I just really love it. It's the perfect size, and I just have all my little notes in here. And one of the things that I highly recommend is to, in the back, I put normal values, like equations, just little things to help you remember. So I know it's backwards, but as you can see, I have like normal pH, normal bicarb, normal CO2, normal O2, normal blood pressure, heart rate, respiratory rate, like just all these normal values for vital signs. Like even if it's something that you're like, I know this already, like it's just easy and convenient to have available, especially in moments where you're like, you know, there's a lot going on, like what's acidosis, what's alkalotic, like, oh, I have it in my notes, you know. So just stuff like that is handy. Some things the preceptor is going to be saying or what they want you to do, it's kind of fast at the moment, so it's like quick to just jot it down. Definitely have a pen and a little notebook. So one of the things that I thought was extremely smart of me and convenient to have are scissors. So as you can see, these are not hospital scissors, these are just normal scissors that I have, that I was like, I'm probably going to need scissors at some point. You guys, I cannot tell you how many times I used my scissors. Like, we were in the ER and a patient was coming in, and I was told to like wrap tape around the suction to keep the suction like constantly suctioning. So you close the little port. And so I taped around the little port, and it wasn't normal medical tape. It was like a different tape, and I couldn't cut it off. Like I couldn't rip it off. And I was like, oh my god, like, it's not working, you know? Like, you're gonna deal with things that packages, tape, like, they just won't open, they won't cut, they won't rip open, you know? And so I'm like trying to do it, and like instantly I was like, scissors. And you know, and in that moment, I was just like, scissors are so convenient. Or, you know, like your preceptor is gonna tell you to open up a nebulizer and set it up, and like maybe the plastic, like, you just never know. I've used it so many times. Highly recommend scissors. What I also recommend is we have a lot of hand sanitizer wipes in our department, and what I would do is I would just sanitize my entire stethoscope after every shift. I would do my scissors, my notebook, my pen. Definitely, you just want to get rid of any sort of bacteria. You don't want to take anything home. And when you do go home, you know, like take off your shoes right by your door, and instantly just go shower. Put your scrubs in like your dirty hamper or whatever, and just take a shower. You just want to make sure, like, you don't want to like sit on your couch and be like, oh, I'm home, with your like nasty scrubs. Like, you don't know what, you just no. So definitely make sure everything is clean before you get too relaxed. So my advice for first year students, for first semester students, is you can do this. Just power through it. Time management, make sure you're studying, make sure you're reading, And yeah, you're gonna have like a great time. Hopefully your first rotation you have excellent preceptors like I did. My hospital, they let us roam around and do our own thing. I was giving breathing treatments, I was auscultating, I was charting, I was doing all their vital signs, I was doing CPT and bedside pep therapy. Like, everything was amazing, and I'm just so grateful that I was thrown into it in my first rotation, that I was able to do things on my own, because I feel like it's really going to prepare me for the next hospitals that I'm going to. Alright everyone, I feel like this video was long enough. That is all of my first rotation, first semester info. I don't want to make this too long, but if you have any questions, please leave a comment below. I will gladly answer it. I will gladly do a Q&A video. And make sure you guys follow me on Instagram at Garry, Garryrt, link below. And yeah, you can follow my medical journey, and I post some fun stuff. And I have a lot of things coming out. I'm going to be doing a few videos with some of my nursing friends, and we are going to compare nurse versus RT and just talk a lot about things like that. So stay tuned. Don't forget to follow me on Instagram and subscribe and like. Thanks guys. Bye.